Your ultimate guide to the P shot. Men, ED can be a difficult, frustrating, and embarrassing issue to deal with. But as technology gets better and better, there are some new effective and hassle-free ED treatments that are becoming more and more available. One of those treatments is actually called the P shot or Priapus shot. This is an ED treatment where we inject your own penis with plasma from your blood. So let's dive into this and see how it can actually help you. Today, we're going to dive into the Priapus shot or P shot for all those curious men out there and answering all of your questions you've ever had. I'll be talking about how it works, what it does inside your body, how do you know if you're a good candidate, what the treatment options are, what it looks like, what the results are, the costs, and what the side effects are. The chapters in this video are in the description below in case you wanted to skip to anything. Don't forget to like and subscribe for more content like this. And let me know in the comments, what's your opinion of the P shot? Have you ever gotten it? Would you ever get it? Why or why not? And if you've tried it, what are the results like? I'd love to hear your thoughts and answer any questions that you have. First off, let's jump right in. How does the P shot actually work? Well, the P shot or Priapus shot is a medical treatment aimed at improving sexual performance in men, particularly those suffering from erectile dysfunction, or ED, and other sexual health-related issues. The procedure involves the following steps. Number 1, blood collection. So a small amount of blood is drawn from your arm, similar to a routine blood test. Number 2, we prepare that blood and spin it down in a centrifuge to extract the PRP or platelet-rich plasma. Platelets are components of blood that release growth factors and help in healing and tissue regeneration. Number 3, injection. The PRP, which is rich in those growth factors, is then injected into specific areas of the penis. This is generally done after applying a local anesthetic cream, so there's no feeling of pain whatsoever. The theory behind the P shot is that the growth factors released by the platelets promote the regeneration of blood vessels and nerve tissues in the penis. This can enhance blood flow, improve erectile function, and possibly increase penis size and sensitivity. So how do you know if you're a good P shot candidate? Well, determining whether someone is a suitable candidate for the P shot involves a thorough evaluation by a healthcare provider. So here are some of the factors that may indicate whether the P shot is appropriate. Number 1, erectile dysfunction. So the primary indication for P shot is issues with erectile dysfunction, such as issues with erections, issues with hardness, issues with staying hard during intercourse. These are all issues where the P shot can improve. Decreased size in the area. If gentlemen want increased size of their penis, the P shot and multiple P shots after that subsequently is a great treatment for that as well. A comprehensive medical history is essential to assess for any underlying health conditions that may impact erectile dysfunction. Making sure that there are no issues with testosterone while at the same time treating ED is also apparent and needs to be done. Really, there's no physical examination that needs to be done with the P shot. It's simply a review of your history as well as doing a shim score, which allows us to see whether a patient has mild, moderate, or severe erectile dysfunction. Your provider will be able to go over this shim score with you in your assessment and let you know which treatment plan is best for you. It's also essential to consider potential risks and contraindications with PRP treatments. Multiple blood dyscrasias, blood cancers, and things like that may disqualify you from getting PRP treatment. Ultimately, the decision to initiate P shots should involve shared decision-making between the patient and the healthcare provider. So this includes discussing the potential benefits, risks, and alternatives to the P shot. So what does the P shot treatment look like, and how many times and how often should you do it? Determining if you are a good candidate for the P shot involves several factors. Usually the procedure is considered in men who are experiencing sexual health issues that might be improved by enhanced blood flow and tissue regeneration. Patients who are also post-prostate surgery usually have some sort of erectile dysfunction, and the P shot can be great for them. Peyronie's disease. Men with Peyronie's disease, which is characterized by the development of fibrous scar tissue inside the penis causing curved, painful erections, can see improvement with the P shot. It can reduce pain and improve erectile function. Realistic expectations are always needed to be discussed. So understanding the potential benefits and limitations of the procedure is crucial. It's not a guaranteed cure for sexual dysfunction, and the results can vary. We do know that more treatments can result in better improvements. So what is the process? How often should you get a P shot? And what are the follow-ups like? Well, first off, you're going to have a consultation. The provider is going to talk with you about your shim score and your history of erectile dysfunction. They're going to ask about things like testosterone levels and other relevant factors that can be contributing to your erectile dysfunction. On the day of treatment, you're going to come in and we will numb the area for about 20 to 30 minutes. This ensures minimal discomfort during the procedure. A small amount of blood is taken from your arm for the PRP and spun down so we could extract the growth factors, which is the PRP, from the blood and inject them. There will be 5 total injections into the penis during the treatment, which you will be completely numbed up. Once the treatment is done, we will train you on how to use the penis pump to ensure maximum efficacy of the treatment. At the same day, you may also get pulse wave or gains wave therapy to help enhance the P shot and enhance the success of the erectile dysfunction treatment. Afterwards, you can go back to your daily activities as soon as you want to. There are no restrictions and no downtime. We always recommend that a patient gets multiple treatments for the highest amount of success. The first 2 treatments are usually 6 weeks apart, followed by multiple treatments every 3 to 6 months. For size, the treatment will occur every month, usually for the first 3 to 4 months. So what results can you expect from the P shot? Well, the results can vary depending on the individual, but several outcomes are commonly reported, and it's important to have realistic expectations with these outcomes. The first one is improved erectile function. Many men report stronger, more sustainable erections after receiving the P shot. This is attributed to the potential regeneration of blood vessels and improved blood flow to the penis facilitated by the growth factors in PRP. Number 2 is enhanced sensitivity. So some men may experience increased sensitivity in the penis, which can lead to enhanced sexual pleasure. Number 3, increased sexual stamina. Improvements in the ability to maintain erections can result in longer lasting sexual encounters. Number 4, reduction in Peyronie's disease symptoms. So for men with Peyronie's, the P shot might help reduce painful erections and decrease the curvature of the penis caused by fibrous scar tissue. Number 5, potential size enhancement. While not universally experienced, there are reports and studies that show an increase in the girth and length of the penis. These changes are typically due to increased blood flow rather than actual tissue growth. Number 6, faster recovery between erections. Men might notice a decrease in the recovery time between erections, allowing for more frequent sexual encounters. 7, overall increase in confidence. Improvements in sexual function often lead to increased sexual confidence, which can positively impact overall quality of life. Now, how much does the P shot cost? Well, the cost of the P shot or Priapus shot can vary widely depending on several factors, including the location of the clinic, the expertise and reputation of the practitioner, the licensing that the practitioner has done. You always want to make sure you're going to a P shot certified provider, and regional market differences. So the price ranges greatly. It's important to note that the P shot is generally not covered by health insurance and is considered an elective procedure. However, the results speak for themselves, and any costs out of pocket are more than worth your time and your effort because the results that we have achieved are amazing with this procedure. Combined with the pump, combined with gains wave therapy, it is the gold standard of treatment. So what are some of the side effects of the P shot? The P shot is actually generally considered to be safe with minimal side effects, primarily because it uses the patient's own blood, which reduces any risk of allergic reactions or rejections. However, with any medical procedure, there's going to be some possible side effects. So let's talk about it. Number 1, pain and discomfort. The injection itself can cause a little bit of pain and discomfort, but most patients just describe it as a pressure in the area. We use local topical anesthesia, and this usually reduces or minimizes any type of pain. Bruising and swelling. We are injecting, so there's going to be some bruising or swelling or redness around the injection, but this usually goes away within a few days. Number 3, with any procedure, there is a small chance of infection. However, we use sterile techniques, clean the area well, and proper aftercare reduce this risk. We've never had an infection before. Bleeding. There might be minor bleeding at the injection site as well, but it will not affect the treatment nor damage the area in any way. Number 5, scar tissue. There can be a potential for scar tissue to develop, particularly in individuals prone to keloids or a history of Peyronie's. In these cases, we still use the smallest needles possible to do the treatment, which has the highest success rate and the lowest risk for scar tissue buildup. And lastly, no improvement. In some cases, there might be no noticeable improvement in sexual function or penis size, which can be frustrating. However, we usually see with time and more treatments, almost every patient improves. We have an over 94% success rate. Temporary numbness. You might have some temporary numbness in the area or decreased sensitivity, but this is temporary and usually comes back very quickly. So it's always crucial to discuss the potential side effects with a healthcare provider who's experienced in the P-shot. They can provide you more detailed information based off your specific health conditions and help you weigh against the risks of the procedure. Now, as a bonus, here's 3 ways to naturally improve your ED before having to resort to treatments like the P-shot. Number 1, change your lifestyle. Exercise, regular physical activity, especially cardiovascular exercises, can improve blood flow circulation, increase testosterone levels, enhance the endothelial function, which is crucial for achieving and maintaining erections. Number 2, diet. Eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins can help overall cardiovascular health. Those can all help with increased blood flow and increased oxygenation. Number 3, maintain a healthy weight. Being overweight or obese can contribute to ED by exacerbating cardiovascular issues, diabetes, all which damage blood flow. Losing weight through diet and exercise can significantly improve sexual function. Lastly, limiting alcohol and quitting smoking. Excessive alcohol and smoking can impede blood flow, leading to worsening ED. So reducing alcohol consumption and quitting smoking can improve your symptoms. And lastly, stress reduction and psychological therapies. Counseling. Psychological factors such as stress, anxiety, and depression can contribute to ED, so sometimes counseling or therapy can also help address these issues, often improving ED. Also, mindfulness and meditation such as yoga and meditation that reduces stress and improves overall mental health can potentially help with this as well. Make sure you're sleeping well. Adequate and quality sleep is essential for sexual health. Sleep disorders can lead to a reduction in testosterone levels and impact erectile function. There you go, your ultimate guide to the P-shot. If you think the P-shot could be right for you, reach out to us at the link in the description below. We have 19 locations and growing around the country to serve you, and we have treated tens of thousands of patients with the P-shot every year. We'll see you next time.